Well, let's bring in our guests to look at efforts towards revamping primary healthcare centers and also managing disease outbreaks. We have joining us via Zoom from Lagos, the Minister of State Health and Social Welfare, Dr. Isiaq Salako. Thank you very much, Honorable Minister, for joining us.
Thank you very much for having me. Good evening, Nigerians.
Good evening to you. And we have here with us in our Abuja studio, Dr. Isaac Abuja. He's a public health specialist. Thank you very much for joining us, Dr. Abuja.
Thank you for having me. Good evening.
Fantastic. All right, let's get to the Honorable Minister. You have seen the issues play out from the reports, talking about the strides and also some of the challenges being recorded in the aspect of having functional primary health care centers and dealing with disease burden in the country. How would you react to that?
Once again, thank you. Nigeria has a reasonable spread of primary health care centers. Challenge mainly is functionality of those centers. And the government of President Bola Ahmed Tinubu recognize that it is not enough to have buildings if those buildings, that primary health care centers, do not have the requisite manpower, the requisite equipment, the requisite drugs and supplies, then they can be called any building rather than primary health care center. As a result, one of the core agenda of the Health Sector Renewal Investment Initiative of Mr. President is the rehabilitation of primary health care centers across the country. We know that as at the moment, there's an ongoing rehabilitation of about 4,000 primary health care centers to take them to level 2. Level 2 means that they are functional, they have the needed manpower, the supply of electricity is guaranteed, supply of drugs, immunization is guaranteed, and they are also able to access funding for basic healthcare provision from the Basic Healthcare Provision Fund. So about 4,000 ongoing rehabilitation is ongoing now. The target is that by 2027, at least 50% of the primary healthcare centers in Nigeria are rehabilitated and upgraded to level 2. So with this, the delivery of essential healthcare is taking closer to the people, and people are able to access essential healthcare more readily. With the expansion of subscription into the national healthcare insurance, we also guarantee that patients, Nigerians, when they go for essential health care, they do not have to suffer financial hardship. They have to dip their pocket, their hand into their pocket to pay for health care. So robustly, the issue of primary health care is being addressed as the cornerstone of the healthcare delivery system of the government of President Bola Ahmed Tinubu. When it comes to health security, that is responding and addressing outbreaks of diseases, Nigeria is better prepared compared to 2022. The last evaluation that was done by an external body called the Joint External Evaluation, moved Nigeria's rating from about 39% to about 54%, which means Nigeria is better prepared to detect diseases, to prevent and to respond to outbreaks, especially outbreaks like cholera, like Lassa fever, like meningitis, such recurrent outbreaks that we currently have in our country. So I'll say overall, we are making progress with our healthcare delivery system and making sure that health is available to Nigerians.
All right. Thank you very much, Honorable Minister. We'll get back to you, but something very crucial you mentioned, I want Dr. Abuja to respond to. He talked about the aspect of funding, which the federal government is doing its own part. But what role can state governments play, and also the private sector, especially in the aspect you have to keep training frontline health workers to build their capacity to meet, this demand of disease outbreak? Dr. Abuja, please respond.
Okay, yeah. Primary health care generally flourishes well when there is a participation and collaboration between all stakeholders. In Nigeria, we have the federal government, the state governments, and the local governments. And besides those, we also have the private sector. In providing primary healthcare services, it should not only be limited to the governments, whether it is at the federal level or state level or a local government level. Communities are supposed to participate. Individuals are supposed to participate. Yeah. Private sector is also supposed to participate. So it is the participation of all these partners or stakeholders that would make up the good and expected service that we call primary healthcare service. It is not only the government. And if you listen to what the Minister of State just said, efforts are being made to provide more financial resources for health. Especially, it should be noted that this year, 2025, the health budget has been dramatically increased.
Yeah.
And that is heartwarming, because for us to be able to reach those who have not been able, who are not reachable because of distance from healthcare services or because they cannot afford them, there has to be a good budget for health generally and for primary health care in particular. And this should not only be limited at the federal level. States are also supposed to also increase their budgets, and with the local governments now becoming autonomous financially, it is expected that they also should make more financial provisions, because they are the people that will provide the health staff that will man the healthcare centers.
Okay. All right. Thank you very much, Dr. Abuja. We'll take a break. When we come back, we'll pick up with the conversation. Please stay tuned. Thank you for staying with us. As Nigeria battles yet another wave of meningitis, Sokoto State finds itself at the epicenter of the outbreak. But unlike in the past, the response has been swift, structured and robust, led by vibrant primary health care centers, state-level coordination and federal government support. Let's hear from Abdullahi Umar Ilalu.
Cerebrospinal meningitis, a silent killer that strikes with little warning, often begins with symptoms like high fever, severe headache, neck stiffness, and persistent vomiting. In communities with limited access to immediate health care, it spreads rapidly and kills even faster. The recent outbreak in Tambuwal local government, sharing a border with Kebbi State, has triggered a ripple effect across the southern axis of Sokoto State. The State Commissioner for Health, Dr. Faruk Umar Abubakar, says the government is leaving no stone unturned in collaboration with National Center for Disease Control and Prevention and the state's Drug and Medical Supply Agency. Essential drugs are being dispatched to affected areas.
Almost all the cases are brought in the hospitals. They are able to receive treatment, and His Excellency provide adequate number of drugs, and the drugs were supplied from all the 5 isolation centers created. And the only emphasis is to immunize the health workers who are also involved in handling this patient. They are immunized, and all the community are also immunized.
Nigerian Center for Disease Control has sent the rapid response team in order to align with the state and make sure for the outbreak in the state. So the state is ready to do the reactive vaccination of this cerebrospinal meningitis in most of the affected LGS in Sokoto State.
With Sokoto State primary health care centers now operating as critical first responders and health educators in rural communities, the approach to public health appears not only effective, but exemplary. From Sokoto, Abdullah Umar Ilalu, NTA News.
All right, let's connect back to the Minister of State. Honorable Minister, you saw the report from Sokoto State, which not just for meningitis, but other aspects. How is the ministry getting it? What kind of feedback, rather, is the ministry getting across states in the aspect of response and ensuring that these primary healthcare centers have adequate supply, vaccines, and, of course, crucial health materials?
Thank you once again. First, I must commend the Sokoto State authorities from the governor and all the health authorities for the very robust response that they have taken with respect to the current outbreak of meningitis in the state. It is not possible to completely eliminate infectious diseases. The catch is to ensure that we detect early when there's an outbreak. That is when prevention fails. We detect early and also have in place a robust response plan. At the moment, across Nigeria, the 36 states of Nigeria plus Abuja has an emergency operation mechanism that is able to monitor epidemics, infectious diseases of public health importance, and able to also robustly respond by placing consumables, needed drugs, needed supplies to ensure that the response to such diseases is adequate. The Center for Disease Control, the National Center for Disease Control, coordinates these activities through the state apparatus of the state government. So this is ongoing, and you will see that in most of the outbreaks that we've suffered, for example, diphtheria in Lagos, the response was robust. Meningitis now in Sokoto, we're having a robust response. So clearly, the evaluation that was done in 2023 that showed that Nigeria is better prepared to respond to epidemics is being validated by this robust response that we're getting.
All right, thank you, Honorable Minister. Let's hear from Dr. Abuja. The role of technology in expanding the scope, having the swift response and meeting demands right on time.
Well, technology has a lot of role to play in providing primary healthcare services, starting, for example, health promotion, disease prevention, treatment, and so on. When you look at technology, for example, here in Nigeria, let's take immunization, which is one of the services that is provided in the healthcare centers. Previously, we had serious problem with electricity supply, but recently, during the report you listened to it too, that the provision of solar energy, which powers the cold chain where vaccines are stored, has helped a lot in terms of making sure that the vaccines are kept in the right condition and are given to those who need them when they need them and where they need them.
All right, thank you, Dr. Abuja. Honorable Minister, I'd like to hear your final thoughts concerning this issue, especially in the aspect of affordability, availability, and accessibility. What hope are you giving Nigerians?
Well, I can tell you that clearly that Mr. President Bola Ahmed Tinubu, in his manifesto statement, the Renew Hope agenda, when talking about healthcare, he said health is a matter of urgent right for all Nigerians, which means that he considered that healthcare should be available, should be affordable, should be accessible to all Nigerians. And that is why there's a lot of priority attention being given to the healthcare sector. In terms of funding, which Dr. Abuja alluded to, the funding for the healthcare sector has significantly increased over the years. In terms of recruitment of healthcare workers, we now have a situation where it is easier to recruit healthcare workers. In terms of expansion of training of healthcare workers, nurses, doctors, pharmacists, laboratory scientists, the capacity to train has also increased. In terms of providing curative care, the government has also expanded facilities for cancer care, facilities for tertiary care. At the moment, during this administration alone, President Bola Ahmed Tinubu has created at least 12 new federal tertiary health institutions across the 6 geopolitical zones in Nigeria. All these are being done to ensure that healthcare services is made available, is made accessible, and is made affordable by providing insurance cover for the vulnerable Nigerians that cannot afford healthcare.